Our first discussion about the placement of a MO intermediate restorative material on tooth number 19 involves selection of a matrix and selection of a wedge and the choice of which side, whether it be buccal or lingual, that we place the wedge. When a preparation is clearly more greatly gapped on the buccal than on the lingual, and as we can see in this preparation, the preparation more closely in the gingival box almost touches tooth number 20, and on the buccal aspect, the gingival box leaves a little more gap, then it's very obvious that the wedge would be better placed from the buccal. If we had a situation where this preparation space was greater on the lingual side, then it would be appropriate to place the wedge from the lingual. So preparation distances between the proximal box and the next tooth help to determine not only which side we wedge from, but how thick the wedge should be. If the wedge needs to be thicker in this case, we might change the wedge to an angle where we use the wider portion of the wedge and hold the band up more tightly against the gingival of the tooth. We'll now place the automatrix band. Check to make sure it's not impinging on soft tissue. The band can be tightened by tightening this area here. And then place the wooden wedge from the buccal. The pressure in this area will help to separate slightly the two teeth, and with a little bit of flex in the periodontal ligament space, once we remove the wedge, the teeth will tend to rebound back together, compensating for the space that the matrix is taking up. This completes the placement of the wedge and the matrix, and we're now ready to place our IRM in the MO of number 19.